we put the question that the motion be agreed to the honourable member for Menzies.
Thank you, Mr Deputy Speaker. The Melbourne Age reported on September 30 last year that almost 40,000 frontline workers will be trained in how to deal with ICE-affected people in an admission that the drug epidemic is taking a toll on an unprecedented number of workers. The paper had earlier reported that the devastating impact of the drug ICE has hit Victorian schools, with agencies fielding calls from desperate principals wanting help. Students are turning up to class ravaged by ICE or crystal meth, with some teachers now working in pairs for safety. Deputy Speaker, Australia's approach to the challenge of illicit drug use has broadly fallen into 3, possibly 4 phases, approximately a decade in length, beginning in 1985. The first phase was a response to the outbreak of HIV/AIDS. In an endeavour to reduce injury whilst not stigmatising the inflicted, a policy of harm reduction was adopted. Deliberately or otherwise, the previous approach was changed. Drug use was seen as a legitimate lifestyle choice. The policy drift away from prevention was reversed by the Howard government in 1998. Implementing a tough on drugs program, the national government placed greater emphasis on the reduction of illicit drug supply and prevention through education, diversion and treatment programs. The implementation of a balanced model more akin to the Swedish approach drew local critics who regarded addicts as victims. Since the Howard era, drug policy and practice returned to the earlier harm reduction model. While prevention is given lip service, the emphasis remains on decreasing the injury to individuals rather than tackling the supply and the use of illicit drugs as such. A fourth phase has hopefully replaced the third, following widespread community concern about the ICE epidemic. The National ICE Task Force, established by the Howard government in 2015, found that more than 200,000 Australians were using the crystalline form of methamphetamine, commonly known as ICE, in 2013, compared to fewer than 100,000 in 2007. It found that the distress that ICE causes to individuals, families, communities and frontline workers is disproportionate to that caused by other drugs. It proposed both primary prevention and effective treatment. So, Mr Deputy Speaker, looking at these 4 phases, what has been the impact of the previous various approaches? Well, first, illicit drug use increased from 39.3% of people aged 14 years and older in 1995 to 46% in 1998. In 2001, it had fallen back to 37.7%, rising to 38.1% in 2004. But since 2007, it has climbed again to 41.8%. Secondly, the death rates from opiate overdose for persons aged 15 to 54 increased from 36.6 deaths per million in 1988 to 101.9 in 1991. From 1999 to 2004, they fell back to 31.3 deaths per million. In 2004, there were 320 overdose deaths. By 2011, the number had risen to 715. Thirdly, hepatitis C infections also increased significantly to a peak of 14,000 new cases in 1999 before falling in the following years. And fourthly, the use of methamphetamines has escalated to alarming levels over the past decade. For some people, we tragically know that ICE can be a trigger psychological disturbances or violent or aggressive behaviour. Long-term use may damage the brain and cause impaired attention, memory and motor skills. So what we see is that the use of these drugs has largely replicated in terms of the intensity or the incidence of the use, has largely replicated the approaches that have been taken, Deputy Speaker, over the last 20 to 30 years or so. When the policy has been one which has laxed drug use and of course the adverse consequences has gone up, when it's been a tougher approach, particularly on prevention and supply, then use has gone down. The evidence reveals that Australia's recent approach is far from world's best practice and is failing many individuals and families. Therefore, Deputy Speaker, a return to a policy of education, prevention and early in treatment and rehabilitation is overly warranted.
I thank the honourable